small, short parts. One of the very important things that I like to make clear is the scope. So whatever I'm going to discuss with you has a very specific scope. This is end service. So we're going to talk only about LGU level. This is catering, retail, and service. So I'm not talking to FDA. I'm not talking to Department of Agriculture. Those are all out of our scope. So no manufacturing or processing, and no primary production. Neither do we have also logistics or transport at the moment. So the scope is very, very important. Of course, we're from the Food Safety and Hygiene Academy of the Philippines, or FoodSHAP. So again, this is the scope, and this is our office. We are located in Alaban, just for your information. The first part is why is food safety not yet happening? I mean, you can talk a lot about the training, and you can talk about the legislations and everything, but we still don't have what we call the food safety culture in the Philippines. One of the points that most of the approaches that we are using at the moment are what we call in health promotion top-down. Top-down means it's all coming from the legislators, from the policies, from the experts, and they are trying to teach. And they're trying to tell people what to do. And then I have never heard anyone mentioning the people themselves. Except today, this morning, when Dr. Vicky and others were talking about what are we going to do with the community, with the mothers, with the health. So when we talk about working with communities, there is some sort of empowerment programs that we can do for people. So where are the food safety associations that include actual people or actual public for us to hear their voices? I mean, we are hearing the voices of experts, of policymakers, of industry, but are we hearing the people of the street, the voices of the street people? I think not. Nor are we hearing the voices of the street vendors. The first thing that I've seen, which is marvelous, the study conducted by the DOH, hats up for them. The only thing missing is that we need to talk to them, we need to give them some resources and let them be involved in the decision making. Is there some sort of an association in local communities for us to discuss public health with the people themselves? This is something, because most of the models now are going from top down. Nothing is empowering people from the bottom up. This is one of the things missing. Nothing will ever happen. Again, anything in this presentation represents my own personal point of view. So I apologize if you don't like it or you don't agree. Forget about it and accept all my respect. I'm just representing my own personal point of view. Nothing will ever happen in the future without focusing on school students. Forget it. If you don't implant those things, it's like crime. I mean, you hear Japan, they have no crime, but they don't have that strong police. Why? Because they are self-governed. Huh? They are like that. Same are for their students. I'm sure that you've heard a lot about what happens to students and the food in Japan, how are they involved in their programs. And very excellent suggestion. I'm not quite sure from whom this morning. They said, if we, I think the FDA, they said if we're going to include it as a subject in economics. Exactly what we put down as one of our recommendations to the plan submitted to this school empowerment program is very important. And not just to include it as a part of curriculum because they will not care about it, but to actually judge them for it or include it in their evaluation and appraisal. So they must be involved. They must be involved in the food preparation on a daily basis. They must be trained on the basics of food safety. So once they grow up and graduate out of school, it's a part of their lives. Food safety is not happening in the Philippines or any other world, parts of the world because it is not second nature. That's the problem. It's not because lack of legislation, it's not because all of these things are important and good, but people don't have knowledge. It's not their culture. It's not how we do things. Have you ever seen food safety on TV shows, cooking shows, or cooking competitions? Do they have food safety there? No. Zero. Not. No matter where you look. Okay? And that's the problem. So if we start with school students, and this is of course a very ambitious thing to do, but if it doesn't happen, I don't think anything will happen. Second thing is, as we said, is media. And this is for the students, we're trying to start something in FoodSHAP called FoodSHAP Kids, where we're trying to work with Deaf Ed and other schools so that we can teach kids at that level. We have both specific, for example, safe knives and things like that for their education. The other thing is media. And as long as media is not involved, we will still have a problem in the country. So we have selected one of the most popular chefs in the Philippines, Chef Boy Logro, to tie up with, and hopefully soon we will have him as the face of the Food Safety and Hygiene Academy of the Philippines, where we are going to start a cooking show. And for the first time in history, we are planning to produce the first cookbook wherein food safety is a part of the recipe. Have you ever seen a recipe starting with wash your hands in any book? No. That's the problem, because people will look at the cookbook and the recipe and then close it and let's do the food safety. Another book. So as long as food safety and cooking are not in the same book, don't expect effective results. It will be really hard to, because you're trying, again, from top, you're trying to control the people, you're trying to tell them what to do, but then they open the book that they use at home. They don't have food safety books at home. They have a cookbook at home. Right? They have a TV at home. They have schools who go to school, they have children who go to school at home. And this is the first part of my presentation. This message is very important. If you do not involve the people, the media, the school children, do not expect any great results, no matter how good you are with your legislation, because people will follow, but then they go home, and there's something else at home, something else in the books, and something else on TV. Okay? And this is what we are trying to do. Of course, we're working alone, and we are, by the way, also one note that we are totally self-funded. This is also one of the things that, I mean, just wish us luck. It's all what we can. This is the first part of my presentation. The second very small part is called the appropriate level of protection. And I'm not quite sure if anyone is aware of that term. If you are, it's okay. If you're not, but I'm wondering if you're aware of it. I haven't heard it yet. And this is one important thing. Peter yesterday in his excellent presentation defined a system as a set of interrelated elements that help the organization reach a goal. So you're trying to talk about your food safety system, but you don't have a goal. I'm not sure what's the goal. So if you have, it's okay. If you don't have, then we should have, or it's up to you. But this is something that comes from policymaker level. So the DOH, FDA, RITM, and of course the Epidemiology Bureau, which is a key player, I'd say new player in the picture of food safety in the Philippines. So let's see what is that appropriate level of protection that you are missing, or maybe I don't know if you have it, but if it was there, it should have been the first thing to be presented in this conference. Because this is where we want to go. Appropriate level of protection is the level of risk a society is willing to accept, defined by, for example, the number of cases of foodborne illnesses per 100,000 people, for example, per year. So now, we couldn't do that before because we didn't have data. But now we have the Epidemiology Bureau with their fine data and excellent data collection that they did. I understand it's only limited to the past 8 months, or I think January to August 2015, and the other meta-analysis for the 10 years. But if you use that and go from there to assess, example is the current level of listeriosis could be 6 per million people per year. But our goal is to have it as 3 per million people per year. This is an example. This is where you set your goal, and from there you go ahead. But now where are you going? That's what the system is defined. You need to reach the goal. My question is, what is your goal? You cannot just say, I want to protect the people, I don't want food poisoning. No, it will not happen. You keep on going in circles. Okay? So please know where you are going. I cannot just take a taxi and tell him go. Go where? Yeah. So once we have our appropriate level of protection decided by the policymaker, then at least we have a north pole, we have a direction, somewhere we're going. And this will only be done using data, which was not there before, but today I dare show you that slide because I know that we have data and they're working on it. This is the second part of my presentation. By the way, this is also one thing that I need to introduce, but not now because it's not the time, something called the FSO and the PO, or the Food Safety Objectives, and the performance objectives. It's too technical. Just let's have our appropriate level of protection first. So just to recap, we need to have this as our set target and then work from there, building a system to reach that place. But if we don't know where we're going, we'll get lost. Next is my first part of the presentation now about FoodSHAP. So I'm done with food safety. Now about the Food Safety and Hygiene Academy of the Philippines. We started actually 5 years ago, but under a different training company. But once the food law was finally, thankfully, thank God, it was issued, then we had some backup that we can work with. And hence we decided to start the first academy in the Philippines in the private sector, which is only specialized in food safety and hygiene training and examination. So we consider ourselves not a training company. It's not a training company. There's an educational institution in charge of developing educational systems and examination systems. Again, the scope is catering and retail and service. We don't do manufacturing or processing. We leave that to the DOST. We don't do primary production or logistics. The system is very simple and very basic, and this is the magic of it. So it's all one course, and it is based on the Food Safety Act that requires all food handlers to be trained in food safety and hygiene and certified, and at least one food safety compliance officer per food establishment to pass the training and examination recognized by the DOH. And once we've read that in the law, this was our challenge. Because when was the IRR issued? That was February 2015, right? So you can, I'm very proud, and thank God, good thing that we're in a country we can say thank God without people thinking, that this is something that you can take off your box. This is one problem solved already. So, and it is very fast. If you leave the government, the problem is if you leave the government to move alone, you'll be very slow in taking action. Not because of them, but because they are weighed down by a lot of systems and bureaucracies taking them back. Once they are being helped or supported by other sectors, things can happen. And this is why, once we've seen that FSCO is a very fresh concept to the Philippines. No one even knows about it yet. But there is something called the Food Safety Compliance Officer. And within less than 8 months, we've developed the system and the course for the FSCO and the examination system, and we had it already approved by DOH, and the MOA is now being signed, thanks of course to WHO and Dr. Bakil and Mansona Bell, and of course the WHO for recommending us in the first place to them, and of course thanks to the city of Muntinlupa, who first adopted our system and accredited us fully to implement the system in the city. The system, again, as I said, is very basic. So you have the basic food safety training. That's a one-day training, but it's a very full day. Some LGUs say, yeah, we'll have a 2-hour training. You cannot do that. What 2-hour training? So you need to really, how was the syllabus developed? What education standards? How were the educational objectives designed? Things like that. So the basic food safety, and then the thing that we're very proud of is our examination system. Now that's the magic of the system. Other than all the other systems, you take a course online, and take an exam online, you don't know who took it for you or who attended it for you or whatever happened. Those systems are questionable. Now our system is 100% controlled and initiated by the government. So what we do is that we have MOAs with different LGUs that they will be invigilating our examination. So we never have an examination without the City Health Office invigilating and controlling the exam. No valid ID, no exam. Simple as that. And at a basic level, because I cannot graduate someone, because for me, license to handle food is like license to drive. It's a license to kill. If you're not licensed properly. Can you take a driving license online? Can you? No. So why do you think that you can take a food safety license online? This is why, especially at the basic level, we have 2 exams. There's the multiple choice exam, which now, by the way, is developed in Tagalog as well. So more people can take it. And we have a practical hazard spotting exam. So one of the requirements is to have a model kitchen where we set up practical stations where we spot the hazards, and we have more than at least 12 stations, and if you don't get 75%, you do not pass. It's as simple as that. And again, everything is videotaped, everything is controlled by the CHO, and the City Health Office are the ones who sign and seal the certificate, so it's a government project. This is why we sought first the help of the DOH permission. After that, you work together with the LGUs and then with the industry. So this is what I call the ripple effect. Because you cannot work at one area. Nothing will happen. But you work with the LGUs, you work with the people, you work with the DOH center, you work with the DOH regional. But we're like that, really, we're jumping like spiders everywhere. Just to try. And again, all what we're asking is your help. Second, for those who pass the basic, we get the HACCP principles and practice. Again, HACCP in catering and retail, for those who don't know, is very different in concept than HACCP in manufacturing and processing. So this is just for you. All what we talk about GMPs, you cannot implement HACCP in a factory and then expect to implement it exactly the same in a kitchen. This is imaginary. It doesn't happen. So there are other approaches when you try to train people to implement HACCP in retail in a kitchen. The exam is, it's a 2-day training. The exam is a multiple choice exam, 70% mark to pass, and there is an open book assignment. Now we take people to a higher level of educational objective, from understanding and remembering to application and development. So they develop their own plan, they apply their knowledge, and we mark. If they pass, they pass. If they don't pass, they cannot go to the final level. Final level of this game is our pride and the pride of the Food Safety Act, of course, the Food Safety Compliance Officer course, FSTO, which is a final 3-day training at a higher level, it's a managerial level, so you don't find a lot of technical stuff there, but it's not as an asset, find more on management, behavioral-based food safety culture, things that we were talking about before. What happens when you give your back to the food handlers and they are on their own? How to involve them, how to engage them, and to make them believe in food safety while you're not there. And this has 3 examinations. Multiple choice exam, an open book case study exam for them. Actually, it immerses them in the food safety law. So we give them actual accidents from what happened last year, from Davao, from Quezon City, from any of the accidents from the newspaper. We give them a copy of the law, we give them a problem, tell us what you think. So we dive inside the law, inside out, we try to solve the problem, we explain. And finally, the final exam is a food safety inspection that they conduct in their own workplace. Once they're done, of course, they are certified. There is a certificate for each level, and then the final certificate, of course, and there are IDs as well. So very, very easy for you to verify. All the certificates are signed and sealed from the City Health Office and has the logo of the DOH and the logo of the City Health Office where the training was conducted. References, of course, were mainly the Sanitation Code of the Philippines, the Food Safety Act, and whatever missing from that DNA was filled up from WHO different documents. And also, of course, the products. This is our baby, the Food Safety Compliance Officer course, which we're very proud of. This is one thing that happened already. Because, as I said, why am I happy is that this is one thing that's done. We have now a system. There is a National Food Safety Training and Examination System approved by the DOH, and it's ready to go this day. And of course, for intellectual property purposes, this is already registered to the FoodSHAP under the intellectual property of the Philippines. So it's only a DOH and a FoodSHAP property. So again, this is the system. So again, it's not that any training company could provide it. You just need to approach us to become one of our providers, and they can deliver it. So we can or outreach. Because on our own, we will not be able to do that. Actually, we don't do that. We have resellers. So there are training providers that will do that all over the country. We are worried about other things, like training of the Department of Education medical officers, training of the food safety inspectors of different LGUs, training of trainers, examination, control, and marking and assessment and development. Those are the things that we do. And all that we do it for free. It is one of the things that you need to know. Anything that we do for the government, for the DOH, for the